The multidisciplinary team should be the core of any centre that sees patients with any form of cancer, and particularly for neuroendocrine tumours, because one wants to garner all the skill set of different specialists. So you need to have the pathologist to look at the biopsies and be able to interpret what grade of neuroendocrine tumour it is. You need to have the radiologist who can look at the scans and interpret those appropriately. The nuclear medicine physician to organise or look at either the octreotide scan or the nuclear medicine FDG PET or the gallium octreotate PET scan. You need to have the endocrinologists who are experts in hormones, the gastroenterologists, because so many of these tumours are associated with the pancreas or the gastrointestinal tract. The surgeons who would operate on the liver or the intestine or the pancreas. And even if they can't do curative operations, surgeon has to be there to discuss the pros and cons of debulking surgery. You have to have the oncologist there who can give chemotherapy and some of the newer oral molecular targeted agents. So you also need to have the clinical oncologists who give radiotherapy. Some patients particularly have got painful bony lesions or particular area in the lung may just have radiotherapy. You need to have the palliative care physicians involved for patients, for their pain control and general ability to be able to cope with their cancer and know that at home they're going to be able to have the resources to control their pain. And so palliative care is very important. You have coordinating it all, the specialist nurse, and they're often the focal point, not only in terms of coordinating for the medical teams, but also the interface with the patient. And now within the UK especially, there are very highly skilled and trained specialist nurses for neuroendocrine tumours who often know as much as many doctors and are very good at having the time to discuss with patients, but to coordinate within the multidisciplinary tumour board meeting and arranging the outcomes of management and coordinating the further tests or treatments that patients require.
Yeah, and I think the nurse has a really key role within the multidisciplinary team, within the actual specialist meetings. I've often got to know the patient well, contacted them, spent time on the phone, really finding out about how they're feeling, what their main concerns are, and not just about the results and everything, but how it's affecting them and their family. So I'm always making sure I bring that into the meeting, so it's more than just the progression of the disease or what the blood results are showing, but it's about actually how they are, what symptoms are they having, how it's affecting their quality of life. So those sort of things are very important. Some specialists cast themselves as a key worker, and I think there's something that's a good word to describe something that we do, that we're a key person that keeps with them. So I see myself as following the patient throughout the pathway wherever they are. That can be in the hospital, but it could also be later on if they say have progressive disease and they're spending more time in the community, but still liaising with the community team and the hospital. So that sort of thing.